The symptoms of coronary artery disease can be a myocardial infarction or a heart attack, or it can be just a pressure pain in your chest as a tightness or sometimes a sharp pain that sometimes goes to your chin, sometimes goes down either arm, sometimes through the back. About 80 to 85% of people who have coronary artery disease, that is blockages in the artery to the muscle of the heart, will have some sort of symptom, either a heart attack or a chest pain called angina pectoris. About 15% of people have no symptom at all, and those are the people who are severely at risk. Mainly out of those 15%, a high portion of diabetics who have bad blockages in the arteries to their heart actually have no symptoms of it. They have what's called silent ischemia. There are a lot of risk factors involved too in getting hardening of the arteries: high blood pressure, high cholesterol, diabetes, inactivity, obesity, but probably the most important risk factor, whether or not you get coronary artery disease or not, is the genes that you inherited from your ancestors. If there's a strongly positive family history of coronary artery disease in the family, that is heart attacks and surgeries and things like that, then obviously you're more prone to get it as well. There are very good screening tests for people who have a family history of coronary artery blockages or heart attacks or bypass surgery. In fact, I generally recommend if somebody in your family, especially a man, has had troubles at a young age, i.e. less than 60, then when your son or your brother gets to be about 40, you should have one of those screening tests, which are stress tests of sorts. Balloons and stents and medicines work very, very well for some patients, but when those treatments do not work, that is when the patient has blockage in what we call the left main coronary artery, or has blockage in 2 of the 3 important blood vessels to the heart, then surgery becomes the best option, because balloons and stents are not nearly as durable as the operation is. You know, a stent may close down in a year or 2, and you have to have another stent, or have to have different vessels stented. So in that situation, the coronary bypass operation becomes a more durable procedure for treating blockages to the heart. Most folks do very, very well and are back to work, depending on what their work is. If they do non-physical work, desk work, they're generally back to work in 4 to 6 weeks. If they do vigorous physical work, it's usually about 12 weeks, because that's how long it takes the bone to knit back together. We've had people that go back to playing active sports, you know, digging in coal mines, climbing power poles, doing heavy physical labor. So once the bone heals, there's really no limitations as to physical activity.